Hi, welcome to my channel. My name is Judith. If you're new here, I am a Kenyan Norwegian who has been living here for quite some time now. So from my last video of how much I get paid as a nurse assistant, I got so many tons of messages, many people asking me how can I become a healthcare worker in Norway. So I've decided to make this video so it can reach many people who are also wondering, and also people who might be in a situation I was in before I started my school, because if I had these informations that I'm going to share with you, I would have made a different decision than the one I did. So if you have moved to Norway, probably you are an adult and wondering what to do, and you're also looking forward to get into healthcare. So this information will really help you make a decision on which route to take. So there are three ways I'm going to share on this video on how to become a healthcare worker in Norway. Number one, if you're done with your Norwegian language, because if you want to work in healthcare, you have to pass your Norwegian language. That is mostly if you are going as a healthcare worker or as a nurse assistant, they want to be one level. If you're going as a nurse, they want B2 level. So once you're done with your B1 level, most people, B1 is easily achievable in 2 years' time. If you're so clever, maybe you get B2, but sometimes getting B2, especially in writing, can be a little challenging because writing is so different. But also I'm going to share with you a little bit of Norwegian language. Norwegian language is so similar with English, Dutch. They have many borrow words that if you speak English or you speak Dutch, it will not be so challenging for you than some people who speak like Russia or Chinese or Indies, that is Mandarin and those other ones. They find it a little bit challenging because of the way it's written and the way it's pronounced. But if you speak English, it will go well for you. I can say that. So yes, once you are done with your language, you can register at videregående skole. So step one is going to videregående skole. Videregående skole is upper high school. Upper high school is where they do the small courses which take 2 years at school. And it's the same place where people who want to go to university, they study there for 3 years to continue to university, or høyere skole as it is called in Norwegian language. From there, you will do 2 years, and the first year is normally called Health or Uppväxt. This is health and childhood upbringing. So after 1 year, then you apply again for the second year. Second year, there are so many different ways you can choose as well. So if you want to go direct to healthcare, you will choose hälsofagarbeider. So here you will you go to school from Monday to Friday. It's a full time. From Monday to Friday, you have teachers with you. You learn from 8 o'clock, probably 8 o'clock 30 or 9 o'clock until 5. And here you have the teacher with you every day, and there are so many other subjects you are going to learn as well: mathematics, English, science, samfundsfag. There are so many of them, and then you are going to also learn the course coursework like helsefrämjande, communication, och yrkes. So after this, you apply before you finished the time you're almost finished, because you're also going to do exams, which if you pass, you proceed to apprentice. Apprentice, you will have to apply for it as well. Normally, the teacher helps you at school to apply for this one. And then this apprentice, you do it for different departments. Department one is with the elders, home for the elders, and they are different. There is home for the elders sick, and then there is psychiatric avdeling department, and then there is another rehabilitation, and then there is another department with the one they call nurses services, where they visit homes. So you go to these four different, which give you the idea, and from here you can even also choose where you fit well, where you want to work. So with the videregående school, you will have to do 4 years. And these 4 years, the 2 years you are at apprentice, they normally get paid, but it's quite late low. The first 6 months, I think it's 40%, if I'm not wrong. And then it increases, but it's so small. So if you're an adult who is like 50s, in their 40s, sitting in class with 15-year-old and 16-year-olds is not easy. I was there, I tried it. I had just started, so I could not stop, but it was not easy for me. Yeah. Step two, you are done with your language, then you just start working. You look for job. There are so many jobs. Here you will get a job as a plumber rider, and in English it's called nurse assistant, and you will be paid as a ufaglet, which means unprofessional because you have not specialized. You will work for 1 year and a half probably to get hours, because you must have hours before you can apply for the adult school. And adult school, you will apply for it as well. Probably if you have like 2,000 hours, that is a little of 1 year plus. Then there you will study for 2 years. The first year they go to school, physical class twice a week, and they learn also different subjects. They meet in group, they are put in groups, people you can communicate with, you do homework together with. It's like you're a group team. And then if you're done with first year, then second year, they go to physical class once a week. So this one passes for many people who want to, probably you want to work as well. You have a family back at home. If you have moved from Africa or Asia, places where you always have to support people back at home. Also, you have your life here in Norway, which is quite expensive. You're going to pay for it, and so you want to work, and you do not want to sit in class every day, Monday to Friday. So this way they get you quicker to work. So if I had this information, I would have gone for this step too, because there are some of my colleagues who I know who started after I had started, and now they're already authorized healthcare workers, even we for myself. So here once you have 3,500 hours, then you can take the practical exams. And if you pass this, then you apply for authorization, and then you become authorized healthcare worker in Norway. Then the last step, step three, this is if you're an adult, probably you are in your 50s, you're in your 60s, you cannot go to school, sit with the young people, and also you do not want to rush to take the exams because probably you are not so good with the language. It's giving you a little problem, and also you need the money, you want to work, so you can always get a job full time if it's possible. You work and save time, you save the hours up to 8,000. Once you have 8,000, that is probably 5 years if you're working full time. If you're working not full time, like 80% to 70, then probably it will be 9 years or even 10 years. Then you register and take your exams. You will take theory exam first. If you passed it, then you will take the practical exams at your place of work. Then after that, you become healthcare worker, recognized, authorized healthcare worker in Norway with your certificates. Yeah, so those are the 3 steps of becoming a healthcare worker in Norway. And also, you can always ask people around at school. You can always ask the teachers. One thing I know, the teachers will want you to sit in the class. They, but I know as an adult, it's not easy to sit in class with those young people. I was there, and it was very challenging. So also after you are done as an healthcare worker and you still feel like you want more education, probably you are also there and just thinking, oh, is this what I really want? You can take POBIG. POBIG is competence skills. This one you can take private if you want, or if you have gone to Vidrego, and you can take it at school as well. You just register for it. But this means you will have to go to school full time. But this, if you are if you're young, you're in your 20s, you can do this. If you're in your 40s, 30s, late 30s, you can do the private. You study at home and then register for exams and then do the exams. Then this will give you opportunity to go to university or högre skola, as it's called, högre skola eller universitet. So this will help you to study also. There are so many other ways you can take. You can study social work, which is called vernepleie. You can go to Bachelor of Nursing, because to become a nurse in Norway, you must have bachelor's education. That is 3 years. Also vernepleie, which is social studies, is also 3 years. Psycholog, there are so many other ways. Pedagogist, yeah, there are so many. You can even become a teacher if you want, a primary teacher or a kindergarten teacher. There are so many other ways. So if you're moving to Norway, there are so many opportunities here for studies. If you get the right education, you will get the job you want, you will get the good salary you want. So welcome to Norway. If you're new in Norway, please get in the comment right there. Let's get to know each other. Let's get to help each other well with the information I have, with the knowledge now that I have after going to school here. I can help you because nobody gave me this information. I was really looking everywhere and there was nowhere to get such information. And so I made some decision that now that I know, I would have done them differently. So thank you for watching. If you're new here, my name is Judith, Adventures of Judy. If you like such topics, subscribe, hit the like button, share with people you know, and thank you so much for watching. Bye for today. See you on the next video.